Hello, my name is Dr. Louis Sclafani, and I'm a licensed chiropractic physician. I'm also the health director for Medical Products Online. Please remember to consult with your own doctor before using these products. Today we're going to talk about a muscle stimulation unit known as the MPO 7500 or Ultra Muscle Stim. You'll notice that your product comes with everything that you need to get started. The pamphlet, 4 electrodes that are reusable, the unit itself, lead wires, and a battery. This is a 3-mode, 2-channel muscle stimulation unit. Your battery goes in the back compartment, and please remember to align the positive and negative properly. And what we're going to do is hook up this device to channel 1. You put your lead wire snugly in the top, and then connect to your electrodes. Put the pins in securely, and then you put your electrodes on the treatment area according to your doctor's recommendations. We're going to lift the safety cap and then open the control door. First thing we're going to do is rotate the knob clockwise, and we're going to hear a click and also hear a beep, and we'll see the display showing channel 1. Using the mode button, we're going to scroll through the different modes. Constant mode. In constant mode, the device turns on and stays on. In the synchronous mode, the 2 channels will come on simultaneously, and then they will go off simultaneously according to the way you've set it up. And then in alternate mode, the 1 channel will turn on while the other is off, and then when that channel comes on, the other one will turn off, and that will continue throughout the duration of the treatment. For today's purposes, we're going to use synchronous mode, so we're going to scroll down to the synchronous, where synchronous is displayed, and then we're going to press the set button. This is going to allow us to change several parameters. The ramp time. Ramp time is how long it takes for the device to go from no electrical impulse up to the desired setting. Usually 5 to 10 seconds is reasonable. This way your device doesn't just turn on and jolt you. So we're going to now up arrow to about 10 seconds, and then we're going to press set again, and now you're going to see that on is displayed. This tells us how long the device stays on after the ramp has come to the maximum point, and depending on if you're using this for muscle re-education or muscle spasm control or just to reduce edema in muscles, you'll set that according to your doctor's recommendations. And then we're going to press the set button again, and now you'll see off displayed. That will tell you how long the device will stay off, and there's no electrical impulse until the next ramp cycle. So again, we're going to change this, and we'll set this to 15 seconds. Press the set button again, and now the width is displayed. This is telling us the pulse width. So if we were down at 3 to 4 pulses per second, we would actually feel individual pulses. And the width of that pulse in microseconds can be changed with the up and down arrow. Again, you will follow your doctor's recommendations as to what that setting should be. If we press set again, now we're displaying the rate button. And again, as I said before, if we were down at 3 or 4 pulses per second, you'd actually feel that. But we can raise this into 100 or 200, and when you're at that level, you will not be able to feel the different pulses. Instead, you might feel a pulse and actually an intensity shift when you're doing that. And again, you would ask your doctor for those recommendations. Once we have all of these parameters changed, we're going to press the set button one more time, and now the minutes are displayed. And with that, you can set the duration of your treatment, and usually for a muscle stim treatment, 15 to 30 minutes is adequate. Once we have reached that point, then we close this door. Then we will increase the intensity slowly. Again, if we're in synchronous mode, remember, you may be in a ramp off, so you're not feeling the intensity, so you want to wait till you're actually feeling some stimulation, and then you'll actually make that comfortable, and you may need to change that later on in your treatment cycle, but close the cap. Then you can put this on your belt, and when the treatment is finished, the device will turn off on its own. But then remember to also click it off so you can save your battery life, and then store your electrodes in the moisture-proof bag that they've come in so they don't dry out, and then be careful with your lead wire, and you'll be able to use it for many, many times. We want to thank you for joining us again at Medical Products Online, and please remember to discuss the use of this device with your doctor before using it. And if you have any questions, please feel free to call us or email us at Medical Products Online.